So a new Quartz investigation revealed that ICE may be facing a mumps epidemic at the border. According to the news organization, the federal agency confirmed 236 cases of mumps in early March and has not updated that number. So we really don't know where that number stands. The disease has spread across multiple states since then. More than 30 facilities have migrants who have been quarantined for mumps and chickenpox. We've reached out to ICE for comment and have not heard back. But joining me now from Washington is Quartz reporter Heather Timmons to talk about this. So, Heather, first off, why is this spreading? I know that it's sort of pretty obvious when we're talking about migrants in a small space, but explain to me, how and why the mumps are spreading across multiple facilities.
Well, we have people coming from Central America, countries where they are not necessarily vaccinated for mumps, measles, rubella, as well as they are in Mexico. And then folks are staying in terrible conditions. They're either staying in some Remain in Mexico camps that are not very sanitary, or they're being forced through processing facilities in the U.S. And then because of the president's policies, they're being forced into detention. So you have people that aren't necessarily being screened for disease, not being vaccinated, and then they're being shipped to dozens of detention centers around the United States, which is essentially shipping mumps around the country.
When I read your article, one of the things that I thought was quite troubling is that this information, collecting the information about the number of migrants who have been infected and other health information, that's actually not coming from ICE.
No, it's not. We worked with some immigration authorities who were concerned that they couldn't get in touch with any of their clients. So they started their own private spreadsheet identifying different facilities where they had said there were mumps outbreaks. And then what we did is we called the state and local health authorities in all of those places to try to figure out just how many cases they had. Some of them were great. The state of Colorado, has got exact numbers. They vaccinated tons of people, over 1,000 people in one facility. And other states like Louisiana, they said, listen, this isn't us, this is ICE. ICE is using private facilities, maybe talk to the private prison companies. So, it's very clear that some states just don't have a good picture of what's going on there.
So we have covered a number of situations where children have died while in custody. I'm wondering if the mumps outbreak, or perhaps is the general way migrants and their health, the way that's handled, could that be contributing to, these deaths that we're seeing?
Yeah, I think so. There's just not oversight or standard processes for screening people for disease, for quarantining them, for vaccinating them, for making sure that they're safe. And when you start packing a bunch of people into small situations, and people that haven't committed a crime and don't really need to be detained, you're going to get health outbreaks like this. The one thing that doctors kept saying to me when we reported this story was, thank God it's not measles, because that's much more contagious and much more deadly.
Well, it's funny because when I read it, I actually thought about the measles outbreak that, this country is dealing with, and the fact that that MMR vaccine covers both measles and mumps. And, we're dealing with an issue with the measles because people are not getting that vaccine. What happens should the mumps outbreak sort of spread beyond the borders of these migrant centers? But listen, I'm sure ICE doesn't want that to happen. They don't want to be responsible or to be overseeing, any other deaths of children. I shouldn't say responsible, but they don't want to be dealing with any of this sort of stuff. So is ICE changing the way it handles these migrants at all?
I don't have any proof that they are. They have the Department of Homeland Security, right now is in complete flux. There's been a purge from the White House. Almost everybody in every division is an acting director. They have called upon a lot of doctors to help them at the border after the child deaths to try to see if they can do a better job. But I don't think that they have any standard processes that they're changing in terms of vaccination or how they treat people that are sick.
Yeah, and I suppose, with every policy tweak that we hear from the Trump administration in regards to what to do with migrants, then they have to sort of change their policy and change their behavior. And I don't know if the ink ever gets a chance to even dry on any new plans or policies. Heather, thank you so much.
Thank you.